Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we are talking about an immune-mediated disease. Banking on new eosinophilic esophagitis treatments. In the bank scene of Mary Poppins, Mr. Dawes Sr. tries to instill good financial sense into Michael Banks by taking his tuppence for investment in the Fidelity Fiduciary Bank. His efforts, however, failed, and young Michael clamored to get his money back. As he yelled, "Give me back my money!" patrons in the main lobby of the bank overheard and, thinking the bank wasn't giving people their money back, started a bank run on Fidelity Fiduciary. Depositors yelled and frantically withdrew all they could until the bank managers refused to release any more funds, causing more panic, uncertainty, and loss of faith in the institution. This was fictional, but it mirrors real-life bank runs and, to a degree, what happens in the throat during eosinophilic esophagitis, or EoE. Eosinophilic esophagitis is an immune-mediated disease that affects at least 150,000 Americans, causing symptoms such as vomiting, difficulty eating, and swallowing difficulties. EoE at a fundamental level is when the immune system misidentifies food particles as allergens and starts panicking. Incidence of eosinophilic esophagitis is rising in America, though it remains hard to diagnose, and most people don't get a proper diagnosis until 4 to 8 years after onset. Unfortunately, just like an unpaid loan, untreated EoE gets worse over time. The esophagus is the tube that connects the throat to the stomach. The tube is lined with mucus and a barrier of special cells called epithelial cells, collectively known as the epithelium. Normally, this epithelial barrier, which is several cells thick, is composed almost exclusively of epithelial cells. People who suffer from EoE have a combination of genetic factors, environmental factors, and a predisposition to extra inflammation in the body, including extra TSLP, which we'll talk about in a minute. For those people, the barrier is slightly permeable and some food particles get through and cause disruption. They're like the Michael Banks yelling for his money back. The epithelial cells release a chemical called thymic stromal lymphopoietin, or TSLP, which is like the patrons in the lobby, screaming and panic withdrawing all their money immediately. TSLP is a type of chemical called an alarmin, and boy does it earn that name. TSLP activates and recruits immune cells, causes the release of chemical signals that initiate a feed-forward loop to amplify its own signal, and even leads to changes in the transcription of DNA into proteins. Two important effects TSLP has on the esophagus are the training of T helper cells and the recruitment of eosinophils into the epithelium. T helper cells are memory immune cells, and TSLP trains them to recognize food as dangerous, which gives EoE its lasting quality. Eosinophils are the major inflammatory cells present in eosinophilic esophagitis. The epithelium normally has no eosinophils in it, so this change is severe and dramatic. The inflammation from eosinophils damages the epithelial barrier, the mucus covering it, and can cause fibrosis in and behind the epithelium. Treating EoE can be difficult. Since EoE is a response to food, elimination diets, where potentially aggravating foods are removed from the diet, are typically used. Elimination diets can range from removing only a few problematic foods to almost everything. A skin prick allergy test has limited predictive value but may find precisely which foods are most likely to cause a allergic-ish response with EoE. Most people find relief from removing the big 6 allergens: soy, egg, milk, wheat, nuts, including peanuts, and seafood, including fish and shellfish. Finally, an elemental diet is an extreme, kind of gross, but highly effective elimination diet option. Elemental diets reduce all foods to their most basic nutritional components, eliminating allergens, flavor, and the need for digestion. If an elimination diet doesn't provide relief, patients may opt for a medical solution. Topical corticosteroids and proton pump inhibitors, or PPIs, are effective first-line medications for some patients. Topical corticosteroids suppress inflammation and immune response, so they may be effective but can lead to increased infections. Proton pump inhibitors lower stomach acid, so they are typically only useful in EoE that is mediated by acid reflux. New biologic medications target specific parts of the inflammation pathway and may have similar anti-inflammatory properties as corticosteroids with fewer side effects. On top of this, clinical trials are underway to investigate the possibility of targeting TSLP and preventing EoE from getting out of control in the first place. With the help of clinical trials, medicine will continue to progress, and you can bank on that. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.